couple of cuts here to really get this off. Okay, you just hold still, please, and look up. And I'm just going to come in and take a look, okay? And this one here, is this a normal one? Or are you able to tell me any sort of shape you see here? Okay, a diamond here. Okay, yeah, and I want to go ahead and just test. Can you see my light through this one? Mm-hmm. Mm-hmm. Right here, please. Okay. And over here. Okay. And what do you think that is? Hello. You're here for a cranial nerve exam today, is that correct? Okay. Sure. And it looks like you sustained an injury. Is that correct? Okay, and the bandage appears to be obstructing your view. Has that been an issue for you? Okay. No, not to worry. We can go ahead and redress that here today. Okay. So first I'll just start off by asking you a few questions, okay? All right. And how long ago did you obtain this injury? Okay. About 4 days ago. All right. And have you been changing the wound at home? Okay. And have you ever had a cranial nerve exam before? Okay. Alright, so not to worry. Really what we're going to be doing today is just making sure that this injury hasn't affected any of your other senses, okay? Alright, so let me just go ahead and take a look and see what we have here. Okay. So I do think we can go ahead and remove this bandaging here and clean it out and perhaps put something on that doesn't obstruct your view so much, okay? Okay. Alright, so let me go ahead and just, I think we'll need to make a couple of cuts here to really get this off. Okay, you just hold still, please, and look up. Okay, thank you. Yeah, it must have been quite a fall that you had. What were you doing at the time? Okay, you fell down some stairs. Yeah, that'll do it. That happens. Okay, and let's see here. We'll just need to get little tweezers here to really pull this off for you. Just go ahead and look up again and sit still, please. Thank you. Okay, and this might hurt a little bit, but I do apologize. I'll try to be as gentle as I can. Okay. How does that feel? Okay. Excellent, excellent. All right, and so I do want to go ahead and just clean that out for you. Let me go ahead and come in here. Okay, go ahead and look up again, please. Okay, thank you. Okay. Yeah, it looks like it's scabbing over pretty nicely. There is still a lot of bruising. Let me know if you feel any pain at all, okay? Yeah, it hurts a little. Okay. I'm going to go ahead and put a little bit of a numbing cream on there for you, okay? If you'll just look up and to the side for me. Okay. I'm just going to come in here. Okay, and so that should make it so that you don't feel as much pain. Okay, just gonna... Okay. Yeah, I think that should definitely help. So we'll go ahead and put a little bit of peroxide on there. and just kind of clean it out for you. All right. Okay. Let's go ahead and look up again into the side. All right. Yeah. This ought to make it a lot better for you to not have that bandage in your eye. Yeah. Okay, and I do have a little bit of ointment that I'm going to put on there, just antibiotic to make sure we don't get any infections, okay? All right, and look up again. Thank you. Okay. All right. Okay, so I do want to also just brush some of that hair out of the way because I don't want it to get stuck in any of the bandaging. So if you'll go ahead and just sit still for me, I'm just going to come in here and brush some of this out of the way. Okay, no pain still, right? Okay, just a little tender. Yeah, that's normal. A lot of this is going to pass really soon and you'll be back to normal. Okay, perfect. And lastly, go ahead and put a bandage on there. Now, would you prefer to have just a regular bandage, or I do have a Paw Patrol bandage as well? Okay, yeah, we can just put something small on there now because it really does look like it's scabbing up nicely. So, okay. We've got a cute little puppy here for you. Okay, just go ahead and place this right there. Okay. Perfect. Throw this part away. All right, and does that feel a little better for you? Okay, great. All right, so then we'll go ahead and get started with the cranial nerve exam portion of this. All right, and so I know you've said you've never had one before, so we'll just be doing a lot of tests today, okay, just to make sure that all your senses are functioning properly. All right, so I'm going to first of all take a look here at your eyes. So if you'll just focus on my nose for me, okay? Just focus right here, and I'm just going to come in and take a look, okay? I'm going to go ahead and cover this eye, okay? Oh, doesn't seem to be too much damage. It does look like you have some redness. I think maybe a few capillaries burst when you had that fall. But other than that, nothing too bad. I am going to go ahead and take a look at this other eye, okay? And let me just come in here. Okay. Yeah, let me cover this eye too, okay? All right. Yeah, this eye looks great. Yeah. I can tell you don't go out into the sun too much. Not a lot of sun damage here on the eyes, but everything looks great on that eye. Like I said, you just have some broken capillaries, it looks like, in this eye here, but that's really normal with a fall like that. So I am going to go ahead and bring out another light here, and I'm just going to have you follow it for me, okay? Just kind of move it around, and if you could just follow it with your eyes for me, okay? All right. Just follow my light, please. Yeah, I am sensing a little bit of a delay with that eye, but nothing too bad, honestly. With an injury like that, that's really normal. So nothing too crazy. I'm not too worried about it right now. But we'll go ahead and do some other tests, okay? All right. So first of all, let me go ahead and show you a couple of letters here, and you can just identify them for me, okay? All right. So can you tell me what this letter is, please? Okay, perfect. And this letter here, please. Okay. And here. All right. And this letter here. Okay. All right. And lastly, we have this one. What is this letter? Okay. Yep. Excellent. Everything seems to be great. So we'll just go ahead and put these aside. Okay. And I am going to go ahead and test a little more here. Okay. And I might bring out my light again. So I have these little screens here, little films. And so this is going to be the regular one here. Okay. So I have a couple of them with different shapes on them. If you see one that looks like this is just a regular one. And anything different is going to be one of my abnormal ones. I'm going to ask you, okay, to identify if it's a normal one or if you see some sort of shape or pattern, okay? So go ahead and tell me what color this one is. It's kind of like a pink, okay? All right. And this one here, is this a normal one? Or are you able to tell me any sort of shape you see here? Okay, a diamond. And what color is this one? Okay, great. So it's purple. Perfect. Okay. And next we have this one here. Okay. And what color is this one? Kind of a clear color. And do you see a shape here? What does this look like to you? Okay, a window. Yeah, why don't you just go ahead and follow my finger around the side here as I trace it. Okay. Yeah, no, everything looks great there. Okay. And this one here, do we see any kind of shape here, or is this just a normal one? Just a normal one, okay. And this one here, any sort of shape? Okay, we do see a circle, kind of like a pie. Yeah, and what color is this one? Okay, excellent. Just a few more of these to go. And this one here, any sort of pattern, or is this a normal one? Okay, kind of like a vent here. Okay, yeah, and I want to go ahead and just test. Can you see my light through this one? Okay, just gonna follow that light for me. Yeah. Alright, excellent. Okay. And this one here, is this a normal one or does it have some sort of pattern on it? Just a normal one, okay. And what color do you see? That's correct. Okay. Last two here, a little interesting. Okay. What colors do you see? Yeah. Do you see two colors or just one? Okay, perfect. You see two. And what do we see here? What is this image that's on it? Okay, yeah. Like some little windows or perhaps a door. Great work. Great work. All right, and last one here. If you could tell me, what colors do we see? Okay, yeah, purple and blue. Okay, and do we see any shapes here? Any patterns? A square, yeah. It's like a window, I would say, yeah. Yeah, excellent work. Yeah, you did great. You did a really good job there. Okay. So now, if you could please, just go ahead and look over here to the side for me. Okay. Just want to see if any strain to the eye is visible after these tests. Doesn't look like it, just kind of looks about the same as before. Okay. Alright, so now I'm going to go ahead and do another test here. If you could please, just look at my palm and tell me how many fingers I'm holding up, okay? Okay. Okay. Perfect. And what about over here on this hand, okay? If you could look right here, please. Okay. Okay. Now I want you to tell me, I'm going to hold up my two fingers here. I want you to tell me which hand wiggles, okay? Just look at my nose, please. Look at my nose. And tell me which hand moves, okay? Okay, now look back at my nose, please. You did great. Now look back at my nose. Okay, when I snap, I want you to look at my nose, okay? When I snap, you'll look at my nose, and then after, look back at my fingers, okay? I just want to follow how your eyes move, okay? Look back at my hand now. Okay. Back to my nose. Okay, looks good. Right, now I want you to tell me which hand is closer to you, okay? This hand over here. Okay. Yes. Okay. Mm-hmm. Mm-hmm. Okay. Mm-hmm. Okay. Excellent, excellent job. Okay. I believe the next thing I'm going to do, I am just going to go ahead and take a few photos here so that way I can have that on record and see in a couple of weeks here when you come back, compare it to how your eyes were today, okay? So, yeah, if you could please just go ahead and look up for me. I am going to bring out my camera light here. Okay, go ahead and look up. Okay. And if you'll look at my hand over here, please. Yeah, just take a look at my hand here. Right here, please. Okay. And over here. Okay, now look at my nose. Okay, excellent, excellent. So now we're going to go ahead and try something else here. I want you to tell me when this object is coming towards you and when it's going away, okay? So if you'll just tell me, is this coming towards you or going away? Okay, coming towards you or going away? All right, coming towards you or going away? Okay, coming towards you or going away? All right, and coming towards you or going away? Okay, last time, is this coming towards you or going away? Okay, Excellent. All right, so that is all for the vision portion. So I am going to go ahead now and test some of your other senses. So if you'll just kind of turn your head to the side for me, please. I am just going to take a look in your ear here. Okay. Yeah, sometimes when we have an injury to the head like this, it can affect our other senses and other parts of the body. So we just want to make sure that everything looks good with the ear there. Yeah, that looks good. Okay, and if you'll turn your head to the other side, please. All right, thank you. Okay. That looks good there too. Okay, you can face me again. All right, and we'll go ahead and test your hearing a little bit here. Okay, so I want you to just focus on me here, and then tell me which side you hear the clicking sound on, okay? I'll go ahead and test it for you on one side. Okay, now let me know which side you hear the clicking on, okay? Okay. Okay. Perfect. Okay. Good. Okay. Yep. Okay. Mm-hmm. Okay. Okay. Excellent. Okay, so that was great. Yeah, it seems like you're able to hear everything quite well. Okay. And I do just want to see how your facial muscles react to some things. So I'm going to come in here and just kind of place my hands at the bottom of your jaw. Okay. And can you smile for me? Okay. Excellent. And can you frown? Okay. All right, can you go like that? Just open your jaw. Okay. Now I'm going to go ahead and try to shut your mouth here, and I want you to give me some resistance, okay? Okay, excellent work. All right, I'm just going to palpate a little bit around your face here. Okay. Does that hurt at all? Okay, no pain. Excellent, okay. So I do have an object here. I am going to touch your face with it, okay? So we have this kind of bristly side here, okay? It's not sharp at all, just soft little bristles. And I'm going to touch it to your cheek, or I'll touch this flatter side to your cheek, okay? And I want you to go ahead and close your eyes for me here in a moment, and then tell me which side is touching you, okay? All right, so go ahead and close your eyes for me. Okay, very good. And just let me know which side is touching your face, okay? Okay. Okay, excellent. Yeah, so it looks like you're getting all of these with no issue, which is fantastic. Okay. So now I want to go ahead and test your scent here, your sense of smell. Okay. Give me just a moment here. There we go. All right. So I have a couple of little scents here for you, and if you could just tell me what you think they are, okay? All right. Okay. And what do you think that is? Rose. Okay, perfect. All right. And this one here, what do we think that is? Eucalyptus, perfect. All right, and last one here. If you could tell me what you think this one is, okay? That is vanilla. Very good job. Okay. All right, so I do just want to test your taste here and make sure that everything is all right there. So I have a couple of drops that I'm going to be putting on your tongue here, and I want you to just tell me what you think the flavor is on it, okay? All right, so we'll go ahead and start with this one. Okay. And if you could please, I'm going to go ahead and place my hand under your jaw here. Okay. If you could just go ahead and tell me what flavor you think this is, okay? Go ahead and stick out your tongue. Thank you. Okay, and what do we think that is? Okay, mint, perfect. Okay. I have one other one here for you. Okay, so we'll go ahead and try this one as well. Alright, and once again, I am going to place my hand under your jaw here, like so. Okay. And I want you to just tell me, what do we think this is, okay? Stick your tongue out. Okay, perfect. Alright, and what flavor do you think that one is? Bubblegum. Okay, perfect. Alright, so that's about everything there. How is your eye feeling? Yeah, a little tired. Okay, it does look like it's a little more red than when we started, but that's pretty normal. Why don't you go ahead and close your eye for me? Okay, close both your eyes. Alright, go ahead and just close them. Okay, and I'm just going to press around your eye here. Do you feel any pain? Okay, and I'm just going to touch your eyelids here. Okay, open your eyes. Yeah, no, that's really normal. In a few hours, it'll just feel fine. It'll be back to normal. Yeah. Okay. Yeah, why don't you go ahead and just blink a few times for me, okay? Just go ahead and blink, blink, blink. Okay. Yeah. Alright then. So, what I'll go ahead and do is I'll put you down for a couple of weeks from now. You can come back in. We'll take a look at some of the pictures that we took today and take some new ones and kind of compare and see where we're at, okay? And we'll see if maybe that has healed. I would recommend changing it out daily, the dressing on there, just to make sure that everything stays safe. Make sure we're cleaning it out daily, okay? All right. Okay, so I'll go ahead and see you then in a couple of weeks. All right, you take care.